So what does a Medicare for All who want it system look like? All right, so I want you to picture this. I want you to picture that you're a business owner, and from year to year, you have no idea how much medical is going to cost your business to provide medical insurance to your employees. And as an employee, you have no idea what it's going to cost you, what your percentage of healthcare premiums is going to be. I want you to also picture, if you're a family, you look at your bill for health insurance, and it's now over $20,000 a year per family. How are you going to be able to afford that? Well, what President Biden is suggesting is a Medicare for all who want it. And he's suggesting to put caps on how much people pay for it, so that we can actually have a system that spans across, treats everybody equally. Again, previous videos have talked about how horrible Medicaid is and how it just needs to be gotten rid of and replaced with Medicare, this type of Medicare for all, that would span different states, that would take care of people, that would pay providers enough to keep the lights on. Medicare for all who want it would accomplish that. If they do this correctly, they will also be able to price negotiate pharmaceuticals, because right now we can't. And that's why prescriptions are over twice in America what they are in any other developed nation for the exact same thing. We would actually also be able to price negotiate in the hospital, so that when you break your arm, you don't have to try to shop around for where you're going to get the best deal. Everybody is going to cover it the same. One set of rules, one set of prices. If you do that, that would save over 2.5 times on hospital bills. And there's a RAND Institute article that speaks about this. 2.5 times. So you have Aetna or Blue Cross or whatever, you're going to pay 2.5 times for the same treatment as someone on Medicare would at the hospital. That's very, very important that we look at that, because with rising copays and with rising deductibles, a lot of that cost comes out of your pocket, not with the Medicare for All who want it system. But this only works if people are thinking about how to set it up so that we can price negotiate and set one set of rules. If we can't do that, the whole system will fall apart. The other part of this is going to be the pre-existing conditions. And we have a whole video that talks about this. But of the 130 plus million people under the age of 65 who have pre-existing conditions, we need to be able to get them medical care. However, it should not be a free pass for people who have medical pre-existing conditions because they've taken poor care of themselves. If you have a pre-existing condition through no fault of your own, absolutely that should be covered and covered abundantly. But if you have a bunch of pre-existing conditions because you just eat poorly and you don't diet and you don't take care of yourself, those costs should be on you, not on the system. And because currently they are on the system, Medicare is set to go bankrupt in 2026. So expanding Medicare to all who want it is just going to make Medicare go bankrupt quicker. We have to find a system where you pay your fair share for things that you can control. And if you can't control it, then the system covers you. We don't have that right now. And if President Biden's trying to expand this without holding people accountable for their own problems that they create through their own poor health choices, the system will collapse and fail horribly. Now, Medicare for All system who wants it will do all sorts of things for the private marketplace, because the private marketplace is going to have to look at all of their costs, at all their profits, and they're going to actually have to be competitive. Because what's happened is that the industry has not regulated their prices. So they're just becoming more and more profitable off of your back. What's also happened, though, is Medicare has been lowering the cost that they're paying providers for services for years. We get paid on a unit basis, so every procedure or office thing is based on how many units that a provider spends in the room, or time, or skill, or these sorts of things. Well, we got paid more per unit in 1998 than we do in 2020. And we're going to be paid even less in 2021. And it's not even keeping up with inflation. So actually, we're getting paid 60% less to do a procedure now than we were in 1998. And that's why providers, they don't have 30 minutes to spend with you anymore. They only have 5 minutes. And even with that, they're barely keeping the lights on, You're not getting good care, and we're getting burnt out because we just can't keep up. So if President Biden wants to expand Medicare for all who want it, he has to seriously take a look at what he's paying for these services, because in a certain respect, you get what you pay for. And if we keep making providers see more and more and more patients and paying them less and less and less, pretty soon you're going to have even more of a healthcare crisis in this country because there's going to be none of us to see the patients. This is a huge, huge topic, and it is a very good thing that he's trying to do if he has comprehensive thought and if he looks at the systemic problems that are present throughout the whole system and puts it together. That's why I'm doing these common sense solutions. I'm trying to educate you, but more importantly, I'm trying to encourage you to look things up on your own. See if they make sense to you. See if I'm telling the truth. Anything that is nuanced takes a lot of thought and effort. And I'm really trying to encourage the new administration to put the necessary work in to think about everything, the intended and unintended consequences, so that we can get to a system that works for everybody. To learn more common sense solutions, to learn how you can personally get involved, and to be the change you wish to see in the world, subscribe to this channel, and we'll let you know when new videos are out. Please also check out the book I wrote, Universal Death Care, a solution for healthcare in the age of entitlement.